Hey everybody, welcome back to another episode of Facebook Live. We're here tonight at East Bay High School as the Indians are taking on the Bloomingdale Bulls, and we are joined here tonight by our newest primary care orthopedist and sports medicine specialist, Dr. George Eldayrie. Dr. Eldayrie, how are you?
Hey, doing great. Thanks, guys.
So Dr. Eldayrie, we just wanted to jump right into it. In sports like football and in pretty much every single sport, there is at least one specialized position where an athlete's going to undergo a lot of specific training and practicing. And that kind of leads us into our topic of the day, sports specialization, specifically in younger athletes. So first question is, what exactly is sports specialization?
Yeah, so every sport has its degree of positions and specialization within the sport. But when we talk about it in the broad sense in the sports medicine world, there's different aspects of sports specialization. And the biggest issue is with kids specializing a little too early. And so we define that as usually when a kid is pushed into or chooses on their own to do just one particular sport or maybe even one position in a sport, usually before the age of 12 is considered when they're specialized.
And, maybe it's more the case with professional athletes where they're specializing in a sport because that's their career, that's what they're doing every day. But obviously that's not the case with their younger athletes where they're juggling school and class and they're still growing and developing physically. But like you said, they do still choose to try and focus on sports specialization. What are the risks that come with a younger athlete specializing in sports?
Right, and so that's a great question. The biggest issue is if kids are doing one particular sport or one particular activity a little too much, they're at risk for overuse injuries, certain types of issues maybe sometimes with how their bones are growing. And so that can predispose them to injuries that occur just from too much repetition, maybe a little too often, or other injuries. And most kids actually do a lot better when they're involved in multiple different sports, so not just specializing in one particular sport. Every kid should probably have a season of about 4 months during the year where they're not doing one particular sport and maybe they're doing something else. So the kid who likes playing football is doing that for most of the year, but gets at least an off season of football training and then does something else like basketball or soccer. And those athletes end up doing better in the long run anyways because they become a little bit more athletic. They develop skills, they stress other joints and parts of their body to help adapt for other types of athletic success. So as a whole, it's not a terrible thing. Most athletes will specialize. Usually by the end of high school, athletes become very good at one particular thing, and then they go and pick. But we've had elite athletes in professional sports. Michael Jordan played basketball and baseball. Kyler Murray, right? Bo Jackson. So you have these athletes that could do so many different things, and that's a testament to the benefit of doing multiple different sports and having skills in all different areas.
So, Dr. Eldayrie, you said that we see a lot of overuse injuries with younger athletes specializing in sports. Are there any type of specific injuries that we see with sports specialization, or is it dependent? Are we seeing is one area of the body more prone to injuries than another?
Yeah, it is, and it's more dependent on what sport we're actually talking about. There's some sports where kids in their youth actually hit the peak of their athletic performance. Those are sports like figure skating and gymnastics. Being younger and more limber actually makes them more elite in that sport. And when the time they get older into high school and college, they're actually kind of on the downturn sometimes. But other sports such as baseball or tennis, something like that, where you're kind of doing the same motions over and over, do put more stress on certain parts. And that could be in the shoulder. We talk about little league shoulder, little league elbow. Those are overuse injuries in throwers, not just baseball, but any type of throwing, a football quarterback. And so it depends on the sport. That will kind of judge where that overuse kind of happens. But it just depends.
And we know this in the sports medicine field, but maybe, the folks back home might not. But sports specialization is a very hot topic now. So why is it so prevalent? Why are we hearing so much about it?
Well, I think it's because the culture in our country is prevalent. Sports is such a huge part of the American culture. And I think kids and parents, they want their kids to be successful. A lot of kids, I was looking at some data, and 80% of kids who reach an elite level of sports think they're going to go professional. realistically, less than 1% of athletes are going to go professional in sports. So I think there's a movement where we're kind of really pushing our kids, maybe a little too much, maybe trying to make them the elite pitcher, maybe starting that a little too early. And there's nothing wrong with that. It's great to put your kid in sport. I think that there's so many benefits to that. But I think it's worthwhile to spice it up a little bit. Baseball, football, soccer, and the benefits from that, we've been seeing a lot of that.
And lastly, Dr. Eldayrie, we treat at Florida Orthopedic Institute orthopedic injuries, musculoskeletal injuries, and sports specialization is more of an idea. So rather than treating an injury, how do we treat a certain mindset?
Yeah, so good question, Kyle. So it's difficult. It's difficult. I think some of the examples we see in the pro sports, like we were just mentioning, people being able to get drafted into baseball and football, it's a testament to what these kids can do and how good it is for them to do multiple different things and really change it up. And specialization is not a huge problem, like I said, when you reach the elite level, but it's more so in that developmental stage. It's having the 10-year-old in baseball 12 months out of the year, and so those types of things, it's hard to change. I think just showing the proof that yes, these injuries are happening. They're happening more frequently, and there's data to support that athletes are doing better when they aren't so specialized so early. And there have been a lot of research on it. It's been a huge topic in sports medicine. We had a huge discussion about it at our annual sports medicine conference. And so these things are just continuing to get more and more data. And as we know more, then hopefully mindsets can change a little bit.
Dr. Eldayrie, thank you so much for being here tonight.
All right. Thanks, everybody.
Thank you so much for watching. For the folks back home, keep staying tuned in, and we will stay keeping you active. Thank you. Have a good night.